Point we're going to cover the bloodborne pathogens portion of the class. We're going to talk to you about how to prevent workplace injuries and how to deal with accidental exposure to bloodborne pathogens. Nobody likes to sit through these classes, but they are mandatory, and hopefully you take something away from it from the class. So we are giving you this, this training for your protection as well as awareness, so you can also help protect other employees. It's also required from the Department of Labor in our own policies in gray. So what is a bloodborne pathogen? Bloodborne pathogen is a microscopic organism that can be carried in the bloodstream. Our exposure to it can come in several different forms. Some of the examples are malaria, brucellosis, syphilis, hepatitis B and C, and also the HIV virus considered with AIDS. HIV virus is the one, again, that leads to the AIDS. It depletes the immune system, so it makes people susceptible to diseases that normally the body can handle. It doesn't really survive well outside of the body, and there are techniques that we use to prevent folks from being exposed to it. Okay. There is no threat to catch the HIV virus through incidental contact with anybody. It has to usually come in the form of direct contact with body substance. Hepatitis B is another virus that is out there, which is a little bit easier to contract. We want you to be very careful with this. Symptoms can include jaundice, which is a yellowing of the skin and also the white part of the eye, fatigue, abdominal pain, loss of appetite, nausea, and vomiting. It can lead to a chronic liver type of disease. There are vaccinations that are available. We offer them to folks that want to participate in the vaccine program. The HBV virus can stay active for outside the body for up to a week, also in dried blood. So again, we need to be very, very cautious about how we treat exposure to this. Symptoms may not show up for several months after exposure to it as well. Hepatitis C is the most common type of bloodborne infection in the United States. Again, the symptoms are very similar with jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea and vomiting. And again, it does attack the liver, so it can cause chronic liver disease and death. So blood body substance that can give you a pathogen can lie in the skin tissue, also other body fluids, blood, saliva, vomit, urine, semen, vaginal secretions, and feces as well. So it can be passed, any of these viruses can be passed with exposure, with contact with the other person's blood or body substances. It can be introduced into our body through mucous membranes, through the eyes, the mouth, the nose, through any broken skin that we may have. And even in the wintertime, sometimes dry skin can be opened up enough to expose it. Also, it can be through contaminated needles or sharp objects that we use in EMS. So if you've been exposed to a bloodborne pathogen, the very first thing we want you to do is to render first aid. First aid should be control the bleeding, if there is any. Then we want you to clean up the wound as best as possible with soap and water. We can be exposed if we're not careful cleaning up the ambulances or other places that we may be introduced to the bloodborne pathogens. So we want you to be very cautious when you're doing janitorial and maintenance type of work. We want you to make sure that if you do have to handle any body fluids at all, that you're wearing the proper protective equipment that we've given you, masks, gloves, and in some cases gowns. So again, wear your personal protective equipment, gloves, masks, CPR masks, and any type of barrier type of products that we issue to you. Treat all blood and body substances as if they were contaminated. It doesn't matter the age or condition of the person. We treat everybody the same way. That way we're cautious every patient that we go to, every time we deal with this. Make sure you wash during the cleanup and contamination, and properly dispose of any contaminated materials that you may come in contact with. Our protective equipment is anything, again, that is used to protect us from exposure. We are using nitrile gloves. We don't use latex anymore because of allergies to them. We also have goggles available for folks, CPR masks, and aprons if needed. We want you to check your PPE, your personal protective equipment, to make sure that it's functional. If there are any tears in it or if it's worn out to a point where it's not serviceable anymore, ask for a new one and we will certainly get it to you. We also want you to remove your personal protective equipment before leaving a contaminated area. We don't want you to bring any piece of protective equipment into an area that should not be exposed to what it's been protecting you from. These are all disposable items, the gloves, the masks, all these are disposable. We don't want you to reuse them or wash them out or anything like that. Discard them as you would any normal trash and make sure it's bagged up. The cartoon to kind of add a little levity to this class. All right, hand washing. We want you to wash your hands immediately after removing your protective equipment. This is in case there are any sort of exposures that the protective equipment hasn't been able to protect you from. Normal soap and water, and you want that to be substantial. Use an antibacterial soap. If soap and water is not available, we do have the antibacterial types of foam that are inside the ambulance. You can use that in the meantime to clean up. So if you think that you've been exposed, what do you want to do? Okay, we want you to first of all we want you to know how you may have been exposed to the bloodborne pathogens. What method did you be exposed to? If there are no infiltrations of the mucous membranes or open skin, it's not considered a real threat or a real injury, but still we want you to wash up and report anything that you feel you would like to report. Okay. It's very important that you do a first report of injury on any exposure because, again, sometimes the symptoms don't show up for quite some time. So simply put, if it's wet, sticky, and it's not yours, don't touch it.